Hi, I'm Rebecca. I'm from Australia and I immigrated to Israel and I live in Haifa. I'm here about 2 to 3 times a week. Yeah. I'm a nurse. I started off working here as a volunteer for a couple of years and I've started working here now officially. I've been here maybe 2.5 years, I think now, and when I first heard about the clinic, I was like, that's for me. And I came and it was in the old clinic, not the clinic that we work at today. Really squished and, everyone helping out, and I love the people, and I really enjoy the work. I think it's really interesting and there's a lot to give, and different ways to help. So, yeah. I guess in size, it's this room is probably about the size of the old clinic, just a little bit bigger, and definitely with facilities. We've got more facilities now and more people volunteering and working here, so it enables us to be able to give more, provide more for the clients, which is really good. Yeah. The range of sort of different things that we're seeing within the clinic are kind of, from here to there. Some of them are really simple and some of them are quite complex, and we have to refer them onto into a hospital depending on our facilities here and what we're able to do. It can be small things like just talking to the patients and checking the blood pressure and reassuring them that what they have is absolutely normal, to broken bones and infections and minor surgeries and x-rays. So yeah, a wide range. In terms of treating someone as a nurse, I see every person the same, and I'm not just saying that because that's what you read in the textbooks and what we're taught at university, but everyone's the same. Like, everyone's a human being and they all deserve to be treated medically, and if I'm able to do that, then I'm happy to. The difference probably, I think, is their situation in Israel, and I can speak as an immigrant, not a refugee, but I went through the medical system and it was really hard for me, and I had the language and I had a little bit of support, and I just think if I'm able to make it easier for someone who doesn't necessarily have the language and doesn't always understand how the system works, then I'm really happy to do that. And I think that the clinic's a really good example of how we're doing that and helping them to integrate into society. So, yeah.
Do you have that experience, or to like a regular?
They're more polite, much more polite. I don't know, I've worked a lot with refugees back home as well, so it's not like it's something new for me. Of course, their culture's different and there's the language barrier, but are they different? Yeah, no, probably not. Yeah. I think that the team, the Tevet's really supportive here, and that's not always in every place that you work, and I think it's an environment that we have to be supportive of each other. I absolutely love working with the Eritrean workers. Firstly, they help me learn Tigrinya, which hopefully, I'd love to be able to do and close the gap even more between all the workers and the patients. Difficulties, obviously the language, but I think having those Eritrean workers really closes the gap. And yet we don't have obviously all the specialties here, and the more we have, the better we're able to treat them, because a lot of them don't feel comfortable being treated outside of this setting. So when we can't help them, or they need to be referred, we sometimes know that they're not going to take up the referral, so it limits what we're able to do for them. So that's probably one of the difficulties, but the more volunteers and workers and support that we have here, I guess the more that we're able to supply for them. Yeah. I feel really proud to work here, and I'm proud of the clinic and what we stand for and what we do, and not just because that they're refugees, but I think we're doing good, and and I don't think you find that in every job. And I feel good coming here, and I could take the train. It takes an hour and a half to get here, and I have no problems doing that because I really enjoy what I'm doing and I'm passionate about what we're doing. I think, like, of course, it's a learning ground. I'm always learning as a nurse. Not every, thing that comes in, I know exactly what to do and how to do it. So I'm learning from the people around me. But I also learn from different cultures, and I feel privileged to be able to nurse for the refugee community, and to understand where they've come from, and help them be a part of the society here. Yeah. I have to think about that one. This is a clinic like any other clinic. I think if you came in and you saw the infrastructure, there's things here that are in hospitals and clinics. But I think what goes on within it when we open the doors is something completely different. And I think actually every person should come to this clinic and see how it runs. I think we're trying to do the best that we can, and what's possible for the people and for the population here. Definitely the more specialties we get, I think the more we're able to provide. And I think that's really important. I would personally probably like to see more primary healthcare being done in terms of educating the community, because I think that can cut out a lot of the incidences and the clients that we see coming in here. A lot of it stems from education, and I think they are doing that here, and they're doing an amazing job at that at the clinic, but I think that there can be more primary healthcare. Yeah.
Thank you very much.
That's okay. Cool, thanks. That was fun.